and hopefully you'll find that helpful as well. So with that, I'm going to turn it over to Laura and Karen to lead us through to today's webinar.
Thanks, Liz. Hi, everybody. Actually, I'm not sure if Jessica's on. Let's go to the next slide and just check in to see if there are any updates from the Alliance for the group. Hi. Jessica, are you on? Oh, wonderful.
Hi, I'm on. Good morning, everybody. Happy Thursday. So I don't have any formal announcements. I do want to let everybody know just a few bits of information that I'll be sharing out. For those of you who are ECM or community support providers, you will have some authorizations from that whole person care pilot that will be expiring June 30th. So I'll be sending out an email probably today or tomorrow on how to continue members so that they can continue receiving ECM or CS services, and then kind of just the process. If you do not want them to continue receiving services, you don't have to complete a PCR or anything like that. Those services will stop when the authorization stops, but I will send out some information on how to continue services. In addition, I've been making a lot of changes in Activate Care, so I'm sure if any of you guys are utilizing them, you have seen them. And so I just wanted to let everybody know I'm aware I'm making a lot of changes and I haven't finalized things yet. And so I am I'm hoping by the end of the week to kind of finalize some of those changes and be able to send out a comprehensive email that just discusses all of the changes, and indicates what you guys can use. And then I'm also working with Activate Care on the reporting piece as well. So just wanted to give you guys some brief updates on that. Also wanted to let this team know that July 1st we will be going live again in Merced County, not live again, but live for the first time in Merced County. So we'll be adding people to these discussions, and so it's exciting to see more providers hop on. And so just wanted to give you guys a heads up. We're adding those 2 new community supports July 1st in both Santa Cruz and Merced counties. And then we will also be adding ECM and CS in the county as of July 1. So those are our major announcements. Like I said, I'm aware that Activate Care, there's been a lot of changes. I'm aware that some of those authorizations are coming up on some expiration. So I will be sending out a lot of information. Bear with me over the next few days, everybody.
Thank you, Jessica. Really helpful updates. Let's go to the next slide. And before we get started, I just want to remind everyone that please use the chat feature today. We have a really productive, we're hoping for a very productive session today on this topic of safety in the field, a lot of practical strategies that we'll be sharing and that we would love to hear from you. So we'll have prompts for the chat, but certainly chat in throughout. And I'll be keeping an eye on that chat. And if we don't get to them during the webinar, we hopefully we'll have time at the end for the Q&A. So please, again, join us in this conversation today about safety. So today you have yours truly, Laura Collins, with you, and Dr. Karen Hill. Hi, Karen. Say night, everybody. To lead this discussion on safety. Let's go to the next slide. So today's agenda, we really are we'll start with the self-care component of safety that a lot of us forget about. We really just think about all those strategies in the second part of the agenda. So we'll touch on self-care, and then we have several steps around that we'll address around safety in the field. So building that emergency safety plan, planning ahead, really every step, when you're on your way, when you get there, when and then during the visit and then after the visit. And then we get to hear again, as Liz mentioned, from the Santa Cruz team, Santa Cruz HSA ECM team, about their actual real life strategies as well. It might be reinforcing after hearing some of our tips, but it's always great to hear from a team in terms of what they're doing. So that'll close us up. Let's go just to the learning objectives. Next slide. All right. So again, we're hoping you'll walk away knowing at least 3 self-care safety resilience tools at least 3 safety considerations for visits in the field, as we put it. And then we will be touching on techniques for verbal de-escalation. And it's kind of a teaser because we actually are going to have a part 2 to this webinar where we really focus on de-escalation strategies. So we'll just touch on that today. I know everyone's very interested in de-escalation techniques as well, key component of safety. But let's go to the next slide and run a poll. We want to hear from you and just get a poll, take a poll. So the question that we have for you, and you can select all that apply, is what is your biggest concern about seeing clients in the field? So either you have no concerns, it's always worth putting it out there, or you're concerned about getting physically hurt, or perhaps you feel like you're lacking skills with working with folks with SMI or with SUD. And then there's that uncertainty and unpredictability of the work. If you guys are answering quickly, this is great.
Mm-hmm.
You're beating me to the questions. Not knowing my client well enough to predict the reactions, and then just not understanding the client's ethnic or cultural background. And then I don't know the neighborhood. Where am I? Just, safety concerns around that. And then any other concerns, you feel free to chat in. And Karen and I are looking at these while you guys are answering. And it looks like there's a lot on those top questions. Some are not concerned. We'll report out in just a second. But we've got a lot in terms of, interest in getting more skills in working with folks with SMI and SUD, and that unpredictability, and again, kind of ties in with not knowing the client well enough.
Yeah, Martine chatted in, just getting people
go ahead,
Martine chatted in, just getting people interested in, the services and the offerings. People just don't seem to be that interested. So that's the engagement part. Yeah, it's hard. Mm-hmm.
And it looks like, Liz, you're sharing it. So if everyone can see, again, a lot of answers around skill set, and then that unpredictability of the work and not knowing the client, and then not always knowing the neighborhood. And then there's a good number of you, 24%, that aren't so concerned. So we hope to hear from you that aren't so concerned. What are you doing that really does alleviate that concern? But
I would also add that for people who aren't concerned, it's okay to have a nice, healthy concern, because sometimes we can be not concerned and get surprised when things happen to us because we feel completely safe. You can be overconfident. So I'm not saying be scared. I'm just saying be mindful.
Aware, mindful.
Yeah.
That's good.
Mm-hmm.
Yeah.
Mm-hmm.
All right, thanks, Liz, for sharing that poll, and thanks everyone it's really nice to get a sense. And it sounds like the concerns that folks are speaking to will be able to speak to today as well. So I'm going to hand the mic over to Karen to get us started.
Okay, well, thank you, Laura. And I want to say thank you, Santa Cruz, and thank you, Monterey, for joining us today. And I want to publicly just have a little say I'm sorry. Yesterday, I had to cancel a coaching call yesterday because there was a safety thing that happened, an accident, and I had to be a nurse for a bit, and I missed my coaching call yesterday. So thank you for understanding, Monterey, for that. Let's go to the next slide. We're going to talk about some steps. So before we get started, we want to just find out some self-care, some core safety things. What does safety mean to you? Can you just pop that in the chat for us? When we talk about safety, what does that mean to you? Just in general. Physical and emotional, peace of mind, emotional, physical, great.
Mm-hmm.
Jennifer. Mm-hmm.
Perfect. Yep.
Yep. Physical safety. People.
A lot of themes here.
Yes. Comfortable
so
to
both physical and emotional.
Mm-hmm.
Yep.
Oh, when dealing with patients who have Hep C. Okay. Okay.
Yep.
Yep. All right. Let's go to the next slide. We're hoping that people are being aware of everything around you. This is interesting because we want you to chat in, but if there are things that you don't feel comfortable chatting in, please feel comfortable bringing these issues up in your coaching call with myself or Laura. so that we can, address these things in a different venue if you don't want to pop it in here. So the first thing I just want folks to think about, there's some importance about being a self-awareness. That's what I'm talking about, is just sort of understanding and managing your own emotions. Oftentimes, those are the things that can make us real nervous. We want to be sure that you're responding to a real danger and just not a perceived one out there, something that you think, oh, you're here, certain neighborhood's really bad, so you walk in there afraid. Is it really an honest thing that you're being concerned about? Understand yourself. Part of this is your own self-awareness and how you react to situations. If you've had a trauma in your life, or you've lived in a place that's very dangerous, you might actually have a hyper response to things. So just understand how you deal with things. Pay attention to your own intuition. Don't minimize. If your gut's talking to you about a situation, make sure you pay attention to it, and then hone in on those communication skills you have. Sometimes we can say things that will trigger a patient, and make sure that you're paying attention to that. Sometimes the patient will say something to you that might trigger you. We also have to check closely with our own cultural biases, what we think another culture or individual is going to think, what our own culture has us bring to a situation. We all have our biases, and we want to make sure that we're mindful of those. We look at them, keep them in check, and then continue to do our work with clients. And then finally, the last two things are really interesting and important for us to think about. Sometimes we respond in different ways because maybe we're tired, we're hungry, we're stressed out, we're just too complacent. We think this is going to be easy peasy, so we don't really put into place our safety rules and think about things. We're not mindful and planful, and that's when things can happen. And then always, 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 no matter how much we try to level the playing field, there is definitely a power dynamic that we want to be mindful of. And sometimes that definitely can trigger patients. I mean, we're the ones that make referrals for them. We're the ones that communicate to their providers. We're the ones that do a lot of, connect them to services. And so there's sometimes that dynamic that we have to think about all the time, so that we're meeting patients where they are, but there's not that hierarchy that we're higher or more knowledgeable necessarily than them. A key thing is remembering that people know more about their lives and their situations certainly than we do. Let's go to the next slide. When we talk about some emergency self-care, some things that can be very helpful is for you, if you're a person who likes to write things down on a little sticky note or a 3x5 card note. If you're not, if you're trying to really not use so much paper, you can do this in your phone, but to make sure that you have a nice emergency self-care plan. Be prepared that when things go kind of cattywampus, you have something that you can do. What to do? What will you do if things go haywire? What to think about a situation, how to avoid, what skills you might want to use. If you see a patient starting to sort of a situation starting to derail, how can you bring it back and decelerate it, just to kind of de-escalate it, and think about that. So think about the things that you do. If it's take a deep breath, write those things down, pause and wait for a second, walk away and come back. Make sure that you're mindful of the things we had on the last slide. Is it your communication? Is this a cultural thing you're thinking about? So maybe just kind of write the 3 things down: what to do in case of an emergency, how you're going to think about a situation, and then what to do to avoid. So those are all things to think about, and just put it in your phone, write it on a piece of paper, maybe look at a card or something before you walk into a situation. Let's go to the next slide. So in the chat, I just have talked about these 3 safety areas. Tell me in chat some steps that you take before you leave for a visit in the field. You're going to see a patient somewhere or a client, resident. You know how we have different terms. Karen Hill, the nurse, may slip and say patient. What do? Make sure your phone is charged. Thank you, Jessica. Right there. That's great. Yep. That's a really important thing to do. Text, somebody said text, buddy system. Okay, let the supervisor know.
I love it.
Read the notes in the file, know what situation, the context, make sure I'm coping, right? Communicate with my team about my whereabouts. Thank you, Marlene, that's good. I'm gonna open these up because these are some good comments.
I love Miguel's comment about my inner Bob Ross, so being calm.
Yep, yeah, because that you know, that if you walk into a situation stressed out, scared, hyper, that's contagious, and that comes to the client. Same thing when you have a client that's stressy like that. Your calm demeanor, your voice, you can all just by that can maybe help to slow things down and stop the situation. Just say, let's just take a deep breath and let's just start again. Don't base your opinion based on others' views. The east side is not always the bad side, as an example. Thank you, Roman. That's very true. So we can, you know, prejudge a situation before we even know. You can be mindful that yes, some things have happened over there, but not every resident in every neighborhood is terrible. Very good. Thank you. That's good. That's how we sort of activate care has a safety flag in it. I haven't seen it used, but there's something to explore. Yes, that's true. Communicate with each other. So you guys have lots of good ideas. And these are things that you could put on that little 3x5 part so that you don't remember. Remember to take each situation individually. Let's go to the next slide. So you guys have said some of these things, but we want you to really think about this. You know, you've said, read the chart. People are doing that. Please don't, if you can at all avoid this, don't go anyplace cold. If nothing else, it really is disrespectful, and it can that can inflame a patient. When you ask the patient questions that somebody else has already asked them, and if you've taken a few minutes to look quickly in the chart, that you would know. It's okay to say, you know, I looked in your chart. I just want to confirm this with you so that they know you've taken a minute, that they're important enough for you to take time. Make sure you've got the right address. Boy, is that something to waste time driving around. You get someplace and it's not there. The phone number's not working. The person's moved. All of these things. You want to review whether there's a history of guns in the home. If there are animals, what kind of animals are they? Are they, you know, locked away? These are conversations that you might, at least about an animal, you might want to ask the patient. Do you have a dog or do you have a cat? Is there a way that you can put them away so that, you know, we can visit if possible? Sometimes the patient may say to you, this is my security job. It calms me down. Those animals are usually okay to be around, but just be mindful of that. You know, animals can be unpredictable, people that they don't know. And then also find out if there's anything that's going on when you call to confirm the appointment, you know, what you can tell on the phone, the client's mood has, you know, are things okay? Is it still okay to come and visit, right? All of those things. And if you have any concern, please ask for help. It's okay to say, you know, I've never been to this neighborhood before. I've never met this client. I've seen some things in the chart that may concern me. Somebody should go with me on this first visit. Yes, April, never let your exit be blocked. Yes, you always want to make sure that you have a clear egress when you go to a place, for sure. Let's go to the next slide. We're going to continue here with some tips. Yes, notifying your supervisor and your team members where you're going. Leave a schedule, an emergency contact with your team members. You can even do this on your desk, leave something on your desk. You can make sure that even your family knows. All of these things so that somebody knows where you are. And then throughout the day, check in, you know, to say, yes, I'm okay. I got here. Things are fine. I'm leaving. Take note of all the possible hazards and report them to the hospital if you get into or the clinic, excuse me, or in your documentation. If you get into the home and there's things that are concerning for you and you have your visit, make sure that you document that for the next time so that someone else isn't taken by surprise. You walk in there and there's, open liquor, or there's a gun or a weapon, or there's drugs or something like that, just so that there's a context, and debrief the situation after you leave. So this is really good. This is a hot topic. People are chatting in. If possible, we always like to be back in the office by 3:30 to avoid being in the field when it's dark. Yes, that's true. It is getting darker later, so I think you might be able to be out a little bit later than that now, certainly during the summertime. But the other thing to be mindful of is the time of month. People get checks on the 1st. Oftentimes, if people are using substances, that's the time they now have money to purchase substances, and things can get a little wild. Towards the end of the month, sometimes things can get a little hairy because people don't have as much money and they can be more desperate. So these are things to think about. Let's go to the next slide. Practice and plan your exits. So when we talk again, I want you to please forgive me when you hear me say things over and over. We're particularly for safety, it's 7 times, 7 different ways. I really want you to be able to take away 3 safety things that you're going to implement. Some of you are already doing some things, but you might pick up a couple of other tips, right? So when we talk about planning ahead, know where you're going. We don't want you to prejudice a neighborhood or a specific area, but to be mindful. We know that areas that typically have lower socioeconomic factors and are less resourced, there can be more crime. That's not a given, but there can be more crime. Know what's happening in the news. If there was a local shooting, or if there's a rash of robberies or things, you're going to be careful and mindful. You're not going to drive your car and leave important, things that could be enticing on the back seat of the car, right? Listen to what colleagues say. If you have a colleague who comes back and says, I was in this neighborhood and this is what happened, think about those kinds of stuff. If there's a lot of construction in an area, you'd have to be able to park your car. I don't want you parking your car or vehicle way, way away from where you're going. So you want to park as close as possible. Someone said you want to be in before dark. That's true. So, we don't be going out in places where you can't see where you're going, where there's not good lighting. Those are areas that's kind of prime for things to happen. Let's go to the next slide. So this is a busy slide, and there's a lot of stuff on this, and we've talked about some of the scrubbing the chart and so forth. I want us to pay attention to the starred areas. So we want to plan those visits for early in the day, not so early that your client's not going to be awake, but if you have an early bird, you get those early birds in. Fully charge your cell phone. Someone said that. That's an important thing. Dress simply. We don't want to draw a lot of attention to ourselves when we're out in the field. You want to have comfortable shoes. Don't wear expensive jewelry, a fancy schmancy watch, or any of those kinds of things. If you carry all of your stuff in a pack so that if you can quickly grab it if you need to leave a place fast, and nothing too expensive. So if you have to leave it, you can leave it and take care of yourself. No pointy-toed shoes or high-heel shoes. Some good solid shoes so that if you need to run, you can run or walk fastly. Make sure that you have all of your hand sanitizer and your safety things in your bag for yourself and for your patient, because we still are in COVID, remember that. So we should be using our masks, washing our hands, social distancing, all of that. And then have a little first aid kit in your car if something happens that you can take care of yourself. Let's go to the next slide. This is really, a lot of us were all sick and tired of COVID, but COVID is not sick and tired of us. Let's go to the next slide. So we still have to do all of those things. You're going to call your the resident that you're going to, the client, ask them if, confirming if they've had an exposure and all those questions. And if there's yes to any of those questions or a lot of hesitancy or unconcern, really consider canceling that appointment and having them follow up with a PCP for sure. Because we want you to be safe yourself. Even if you are vaccinated, we know for sure that people are getting reinfected again, even if they have a vaccination. So be mindful of that. Let's go to the next slide. So let's just say everything's fine, right? Your client has not been in exposures. Yes, they're willing to wear a mask, all of those things. Always make sure that your mask you're wearing it correctly up and around your nose, not down here, not down here, not up there. You wear an N95 if you have one. If you don't, think about double masking. If you just have those thin paper ones, you're going to wash your hands for 20 seconds before and after you leave a site. And that's not, using hand sanitizer and doing this. This is 20 seconds of this until your hands are dry. That's what gets the bacteria off your hands. Stay 6 feet away. If you're in a patient's home, it's okay to maybe leave the door open, make sure that there's ventilation if that's possible, and request if anybody else is in the home that they wear a mask, and request the patient wear a mask. And then if you've got a mask on, you got to keep your hands off the mask. If you take it off, you're going to take it off by the ear and then discard it. So you want to make sure that you have plenty of masks. And if you are going to use that same mask and rewash your mask, that you take it off, have something to put it in, and wash it when you get home at night. Let's go to the next slide, please. So step 2, so on your way, you're going to know your route. It's okay if you're familiar with the neighborhood, you know where you're going to go, but if you don't, it's a brand new patient, you don't know. Let's just map it out. Look on your phone where you're going so you have a clear idea of where you're going to go. Those doors and windows, lock them in your car. Park someplace close if you can, right? You don't want to park in somebody's driveway. So if you have to get away from there quickly, that you got to back out, you want to park on the street so that you can get in your car and go straightly. I'm not trying to straightforward. I'm not trying to frighten anyone. I want you to be mindful. I want you to be safe. And these are things that we all have to pay attention to, whether you're in a low resource area or whether you're in a highbrow area. Crime happens anywhere, right? And it's not often our patients. Sometimes it's not them. They can be victims of crimes. It can be neighborhood. There are people who go to neighborhoods to do harm, and they see you and they can see you as a target. You're going to be walking toward traffic, determined, straight where you're going to go with your bag on your side, whatever you're carrying. You speak to people and you keep going. That can be an inflamed thing when you walk by somebody and you don't speak. You can just say hello and keep going. You're not looking at your phone. You don't have your music blasting as you go, because you need to keep all of your senses alert, right? And then trust your instincts. Let's go to the next slide. So as I said, awareness again, I said this already, speak to people. Your car, if you're using a vehicle, which I'm suspecting most of you are, you don't want to get in your car and go with 1/8 of a tank of gas thinking, oh, after this visit, I'll get gas. Fill your car up. I know gas is expensive. Fill it up, or at least a half a tank, so that you know you can get in and out when you need to. Your tires and everything in good working order. What you don't want is the last visit of the day to get out to your car, or have there be an emergency situation where you need to get away and the car doesn't start, right? And then those valuables, you're going to keep them in the trunk, not in sight. And then here's the other tip. Don't get to the site and say, oh my goodness, I've got the baby's present for the party after work today on the back seat. Let me put it in the trunk. You don't want to do that, because you never know who's looking and watching. And I'll just say this, that happened to me one time in San Francisco. I put my purse, and some things in the trunk of the car, and somebody broke into my car. And I didn't, when I got back to my car, the trunk had been popped open. Let's go to the next slide. I want to hear from you now. So in the chat, tell us some safety steps you take when you arrive at a member's location or their home, wherever you're going to meet them. Maybe you're meeting at a coffee shop or something. Tell me what you kind of do in chat.
There's been so many good tips already.
I know it.
Yeah.
this tells us that
It's
people
great
have
to
been doing this for a long time. So they've
I
learned
love it.
from other people and
Yeah,
text other
texting
members
other
that
team
they've
members
arrived.
about. Yeah.
Yep. Before
Surroundings,
you get out,
great.
check your surroundings.
Surrounding.
That's good. Never put your back to the door. Very smart. That's it.
Mhm.
Yep.
Taking note of possible dangers.
Ask about the COVID. Still nervous
Oh,
about COVID. Yeah, we all are for sure. You know, if you manage your safety stuff, if you're using the right mask, if you're washing your hands when you walk out, taking off your clothes and everything, you know, you can do the best you can to keep yourself safe for sure.
but it's
Invite
good
them
to give them the
outside
option
of the
to meet
residence.
outside. Yeah, that's
Yep.
great.
As long as you can have a confidential conversation. Yeah, scanning the surroundings and the client's behavior. Yes, or then there's some other tips too that we're going to talk about. Thank you. Let's go to the next slide. Excuse me. We want to always be aware of when you walk into, maybe the area is fine, you've done what you need for the car, and you walk into a client's house and it's just something off. You know, you don't know what it is. There's just something off with the client. The conversation might be a little different than the one you had on the phone. You just need to kind of get a sense of what's going on. It's okay to say, is this still a good time? You want to find out who's in the house. Is there somebody else in the house? Who all the players are? And you know, if there's anything that's unsettling, I don't want you just, you know, canceling visits willy-nilly. But if you really feel like this is not a good situation, you should leave, or at least at a minimum, shorten the visit. Do what you have to do right away, and then have another visit later if you can, or say, I'll call you later and we can talk. Sometimes, you know, you want to always make sure that the client is safe. Maybe those nonverbal cues are letting you know that they don't feel safe. So there might be some ways that you can sort of suss that out. Maybe it's calling them. If it seems unsafe or threatening, you need to leave. Your safety comes first. And then we talked about this, being mindful of where you park. Let's go to the next slide. So, you know, we're going to ring that doorbell, not banging on anybody's door and it's kind of scaring them, because that is a trigger for them sometimes too. You're going to stand outside the door, wait, you know, announce who you are. You never go to a site without having your tag. So everybody knows who you are. State who you are again, why you're really there. They, you know, stand a little bit further back from the door, so that we call that a reactionary gap in case there's a situation and you have to back away quickly. Stand on the side so that if somebody swings the door open, you don't get hit by the door. All of these things are things for you to think about, to be mindful when you walk into a place. Don't, you know, you're going to sit by the door. I think someone said that, April said that to us, make sure you have a good exit, but you don't want to put your bag in a way so that if you have to leave suddenly, that you're going to trip over it and hurt yourself. So make sure that that bag is in a place where you can easily grab it and then leave if you need to. Let's go to the next slide, please. Again, upon your arrival, you're setting the tone there. So as I said, you know, be on time. It's so rude to say you're going to have a 10 o'clock appointment and then you stroll up at 10:15 or 10:20. It's one thing if a client's late, but we're the professionals. We need to be on time. And if you are going to be late, that you've called your client ahead of time and said, it's still okay. I'm sorry. I've had, you know, traffic or whatever the situation was, to explain it to them and get their permission, right? Remember that this is their home. It's not like they're coming to the clinic. You are entering their space, right? So yes, you're looking and scanning that area, but it's their home, and maybe they don't keep it as neat and tidy as you would like it, but is it unsafe, right? Is it so untidy that it's a hazard? You might want to ignore some of that. You're going to introduce yourself. If there are other people there, you want to introduce yourself to those people as well, and then get permission to, you know, see if you can talk to the client privately. Make sure that the client is not altered, that they haven't been drinking or they're not under the influence. Very, very difficult to have a meaningful a visit with a client who's under the influence of something, right? Know your skills and know your training. Some people might be able to negotiate some of that. But if you don't have a lot of training in that area, it's okay to say you'll come back on another day, try to do as much as you can. But if it's nonsensical, not. If the patient is so altered that you're concerned, that's something you might want to report to their primary care provider, right? If somebody, you knock on that door and the door is answered by somebody that you don't know who they are, you're not sure who they are, make sure before you walk in there that you check those things. Ask if the client is home, ask if they can come to the door. Just make sure before you walk in that you're walking into a safe environment. It is not unheard of that, for vulnerable patients, that other people take over their apartments and, take their places for their own. So these are all things to be mindful of when you walk in there. Let's go to the next slide. This again is still, again, we're looking at that room. We're thinking we're always going to be safe. We've talked about modify the environment to focus on the visit. So if there's a lot of stuff on the table and you need to use a table, you can ask the client, can I just move these things over a little bit so we can, get this teaching form out, or I can show you this document, or I can put my computer here. Ask for permission before you do that. And if it's just too chaotic or crowded, you can say, can we go someplace else to have this conversation? Now, if your visit is at an encampment, and I know a lot of my folks on here do go to encampments, I don't want you going inside of a tent. You have to figure out a different way to have these visits. I don't know how safe those tents are put up. They can fall down, you could hurt yourself. There's not a way to get out of them. So please don't conduct a visit inside of a tent, even if a client asks you to. Let's go to the next slide, please. This is when we're talking about animals and safety. Ask them to secure their pet. If something happens and a dog gets upset, you don't want to run, because dogs are chasers. That's a natural thing. And if you're bitten, you want to see if there's vaccine records. You want to contact somebody. Use that kit in your car and get a consult from somebody, right? So these are all things that I put cats on here too, because I've known cats to scratch too. And so we just want to be mindful of any kind of pet that's in the home. Let's go to the next slide. So this is just a reiteration, some safety steps. Listen to your gut, knock on that door, wear your badge, ask for permission to come in. If anybody else is in the home, those are all reminders. Next to the next slide, please. Now let's have a little chat here again. So in the chat, all about steps that you take to keep yourself safe during the visit. So I've given you some, but maybe you have other little tips there. In the visit, what do you do? Ramon says the name of the consumer, location you'll meet with them. You should also be added to your work calendar. Very good. Thank you, Ramon, for that. That's a great tip. So that your supervisor and others know exactly where you're going. So what do you do in the home? You're in the home and all is well. What are some things that you put into place? Or at least
there were so many chats, Karen. Yeah, after the last question, there were so many chats that kept coming in. So I think
we're good on this one. Scan the surroundings. Okay. Something comes up, let's just keep moving then. Let's go to the next one. So during this, we have this little step-by-step. You're going to set the tone now, right? You're establishing the goals. Look at the eye contact. You want to make sure that you're listening and that they're talking as much. Be present but vigilant. Thank you, Genevieve. Yes, you want to definitely do that. Get feedback from the individual. This is all part of that engagement. You're selling this program to them for sure and showing them the benefit, but you want that engagement back and forth, how you can help them, what they need, right? Observe their interactions in their environment and reinforce, and always keep your phone and your keys close to you. Those are, if you have to leave everything else You're going to take your phone and your keys when you go. The hands make sure your client's hands are visible for sure. And then reschedule if there's any signs, that's for sure, of any substance or that. Let's go to the next slide, please. Yep. So sometimes things can happen in the visit when it can change. It can all start quite, nice and everything's very amicable and they're talking, and then suddenly things start changing. How would you know that, right? Speech patterns, the tone of voice, their face changes, their body moves, they get more agitated. Maybe you've asked them something. It might even be, maybe you're doing one of your intake questions about substance use, right? And they're mad that you're asking these questions, or they get frustrated. Emotional distress sometimes that can agitate people, something that's bringing up a feeling for them, a sadness. Sometimes it's an irrational distress. They're just nervous about something. And maybe their mental state's not good. You might not know that when you get there. And then you're realizing, wow, something's changed here with the person. Or you've noticed in the conversation. These are all things for you to pay attention to. And of course, intoxication or some kind of substance. Maybe they took some medicine before you got there, or they took some drug before you got there. And in the course of the appointment, things are changing. Let's go to the next slide. Just looking at my time here. So some things you can do in that situation is know who you're speaking with, know your client for sure. Try to stay calm, take a deep breath if you can, slow things down. Stop, soften your tone. If your client is way up here, you can't be way up there too. You slow things down, and that's a little bit contagious, right? Recognize the signs and increasing agitation. They can make us nervous too, but you try to control yourself, right? Make sure that you have your boundaries for sure. Use that motivational interviewing and that empathy. Say you understand that this is hard, that you appreciate them sharing whatever it is with you. Be non-judgmental. Those are often your motivational interviewing skills can go a long way to de-escalating the situation, because there's that ramp up where people get a little agitated, their face and tones change. But if you use some of these tips, you can just bring it right back down. You can say, I'm sorry that upset you. Let's just take a deep breath and let's just start again, right? And if they're willing to do that, you might be able to set the tone and continue to have your visit. But if it doesn't seem like it's going to work, right, then you might have to end your visit and come back a different time in the appointment and reschedule. Make sure that you're keeping your distance so that you don't get hurt. But you notice how I've slowed down, I've lowered my tone. Those are things that can calm yourself down and calm the person that's sitting in front of you. Next slide. So leaving the visit, right? As I said, the same way you leave the same way you got there. You're going to walk with purpose and get to your vehicle. You're going to have your keys in your hand. Look at your surrounding and in your car before you get into it. Get in your car, lock the door, and leave. You're not charting in the car. You're not looking even for your next destination in the car. Pull away and then figure that part out later, or have that written out before where you're going to go. Know where your spaces are in your next visit. And then to text somebody and let them know that you're okay when you're in your car. Next slide. So just in summary now, never dismiss. This is the number one tip, your internal instincts. When you walk into a space, you're going to identify if there's an emergency, how you're going to get out, right? So sit by the door if you can. Keep your keys close by, right? Exit if you feel unsafe. Your safety is paramount. It's the most important thing. We want you back home with your families, right? And be careful about personal information that you give. Don't share too much about where you live and all these other kinds of things. You're not pulling out a wallet to show anybody pictures of your kids and have money. You don't want to do any of that. This is a professional visit, right? And then even if there's a baby or something there and you're trying to, have a relationship, you want to ask permission to hold somebody's child. I might not even hold their child. I might just speak to them and touch them or on the cheek or whatever, because you're really there for the patient. Let's go to the next slide here. And, we're going to hear from, I'm going to turn it over to my colleague, Laura, and we're going to hear from Santa Cruz HSA. Laura, take it away.
Well, thank you so much, Karen, and everyone for putting all those amazing tips in the chat. And just so you know, again, this is being recorded. So these are tips that you can look at once you get a copy of this webinar. Part of the purpose of these webinars is we're sharing with each other. We're hearing from Karen and I, but we're also sharing with each other in terms of best practices and what works for safety. So I have Santa Cruz HSA here with us, and I believe we have Jennifer Bailey, Olivia Vallejo, and Craig Murray on to talk a little bit. We'll do a Q&A about your safety practices. I don't think George is in the office right now, so and Lynn, I'm not sure if you're on, but we're going to talk with that core team. And why don't we just start with a little bit about your team? And I know you all have decided who's speaking when, so just a little bit about Santa Cruz HSA and how many visits you're doing in person a week, for example, and how how work in the field is going.
Good morning, everybody. My name is Olivia, and the team is comprised primarily, the folks that are providing direct client services are Craig, Jennifer, myself, and we also have one peer support coach at this time. We do collaborate with providers within the health services agency, medical assistants, our doctors, IBH. And so we are part of a larger team. We are providing in-person services and have been for quite a while. And we're meeting with people, daily, and are meeting with multiple clients a day. And so the work really is very much in person, especially given the population that we work with.
Was there a transition with COVID restrictions lifting a little bit in terms of being able to get back to in-person work?
Yeah.
How did that go?
So we, at the beginning of the pandemic, when we really didn't know much about the virus, we were really concerned about our patients. Most of our patients don't have access to vehicles. And so we knew that we had to respond in a way to support them in meeting those needs. And so, for example, the team was going out to local food banks, to food distribution centers, and we would drop off these bags of food and other items that they needed in order to keep them safe, because they were much more vulnerable to this virus. We did a lot of phone check-ins in the very beginning, but once restrictions lifted a little bit, I think the shift was that we were able to support them in setting up Zoom appointments with their specialists or their primary care physicians. We were able to actually go into clinics with them, because for about a year and a half, patients weren't going into the clinics. We are now able to go to Social Security benefits offices, the DMV, And so that's been probably the biggest change from earlier in the pandemic.
That's great. Yeah, that you're able to do those, important activities in person with them. I'd love to just kind of get to the meat of the conversation and just hear about any protocols, strategies. I know you've heard a lot already from both the group in the chat, and also from Karen around, safety in the field. And I would love to hear from you what protocols you have in place to make those visits safer, and anything stand out as some strategies that you've learned that are most effective.
I can chime in on this one. I've actually been very impressed with the training today. You've literally hit every note that I have on my presentation. So I'll just kind of run through them real quick. Yeah, making sure you maintain your personal and professional boundaries, never going beyond what you're comfortable with, what you're familiar with, and what you've been trained for. Mindfulness plays a huge part into it, being aware of your surroundings, being focused, staying present. We also have in Santa Cruz County called the MERT team, the Medical Emergency Response Team, which I have their number on speed dial. If I feel that there is a mental health emergency or I don't feel safe, we can call them up, and there's a sheriff's liaison that comes out and assesses the situation. As far as trainings go, motivational interviewing, trauma-informed care is huge. I actually got training in mental health first aid. It was an 8-hour training to help people de-escalate, crisis intervention, conflict resolution. And really, it's just giving you the confidence to go out into the field and knowing that if a situation does present itself, that you're familiar with how to respond to it. Again, so like basic protocols would be our first meeting you never want to do at the client's home. You want to do it in the public space or in the office. You don't want to transport a client if they appear to be intoxicated or they're threatening in any way. You want to dress appropriately for the scene. We talked about that before, wearing the right kind of shoes, but also having your badge or your lanyard visible is actually, as a personal situation, I was walking down in the tent city where the homeless encampment is, and some people were starting to wonder who I was, and then they saw my badge and they're like, oh, okay, he's here to help. So that was a big part of de-escalating just that concern. If you do arrive at a client's home and they're not answering, we're encouraging people not to go into the home, to call and have a welfare check from one of the local law enforcement agencies to avoid any potential dangers in that. Always keep in close communication with your peers and your supervisors. We actually have a safety kit in our car, which has gloves and masks and suits and all those types of things. Early in COVID, we had actually even attempted to put a cellophane barrier between the front seat and the rear seat in the car. I think it lasted about a week before the heat just melted the whole thing down. But fortunately, we don't need that level of protection anymore. But yeah, that pretty much covers the safety protocols that we have in place and the trainings that we've done so far.
Wow.
I have a question. Craig, have you ever had a situation where you actually had to use those skills?
Yes, yeah, frequently actually. A lot of my patients become quite agitated when things aren't going their way. Oftentimes we're in a service provider's office and they hear something that is triggering for them and they lose it, and they require a lot of de-escalation. Sometimes we have to leave the office, talk about it, come back in. There's other people in the waiting room that's triggering to them that require some interventions. Mm-hmm. So it's actually quite frequent that I am being that rock or that support for my client in situations that's overstimulating to them and triggering.
Thank you for sharing that. Mm-hmm.
And it's the mental health first aid training that's really helped with that, Craig?
Yeah, that was through the National Council for Behavioral Health, and it was an 8-hour training course for mental health first aid. And I do find that was helpful.
That's great. I'm so glad that you brought that up. Mental health first aid is such a good basic training that really helps, inform for folks that may not be skilled or knowledgeable about mental illness or SUD. it really kind of translates, you know, how do you actually act in the moment in an understandable way. So that's great that you shared that. And someone was asking about where to find that training. So we can also make sure when we send out the webinar that we have a link to that for the National Council website. And and thank you, Lily. You placed Mental Health First Aid USA. That was great. And then also, it looks like there's a need for the MERT contact info. So thanks for sharing that, Craig. What a great tip that you have, MERT or MERT kind of at your fingertips. Is there anything else before we close today that you all would like to share in terms of why is this, you know, we all know why in person is so important. You sort of talked about that, but is there anything else that you want to share in terms of takeaways from this work from the group?
Sure. I mean, I just, part of the reason I loved whole person care and now continue to work in the ECM program is just the value of doing work in person with the clients is it's so much grander, it's so much bigger because of the rapport and the relationship that you can build with your clients. And I feel like when you have that, the work that you can do together is so much richer. You know, in the pandemic, we did a lot of phone stuff. And when you actually get to meet that person, you know, face to face, and they can start to trust you, and they start seeing you show up for these big appointments, these, you know, stressful kind of encounters that they have to deal with. It just, a lot of our folks I've been told, I've never had anybody who has showed up, you know, like your team has, or like you have. I've never had anybody acknowledge really my birthday. You know, just things like that. And I also feel like it gives them the motivation to work on their goals because they have somebody to kind of walk that line with them. And additionally, there's so many roadblocks all the time. So if you're somebody, you know, like our clients struggling with anxiety, depression, bipolar disorder, just like any of homelessness, like all of it at once, SUD, you know, getting asked to complete tasks can be completely overwhelming. And a lot of times, if you have somebody who is like, look, you know, I'm going to come and pick you up, and we're going to go to the DMV, and we'll start getting these things knocked out, then it allows them to feel like, okay, you know, give them hope. We can do this. You know, my person's going to come, we're going to go, and we're going to start doing this. And roadblocks always happen. So we can deal with them in the moment. And I think that's a huge difference as well of doing in-person work, because you get things done at a quicker pace. You don't have to wait so long in between each task. And, you know, additionally, just the relationship alone, you are, you know, maybe providing motivation. Somebody who has, who isolates a lot, you know, through this pandemic, we had folks that were depressed, like so much more depressed. But you can, you're actually like role modeling relationships and communication and inspiring hope. So that's kind of how I feel about why I love this job in general. And I think why we all do this work is because we like to connect with people and help others. So
absolutely. Thank you so much. Yes, no, I love finishing with the why, right? That grounds us. And again, why we're doing all this work. So let's go. Thanks so much to all of you for sharing those strategies. And again, the why behind the work. And let's go to the next slide since we're out of time, and just touch on the fact that we'd love to assign some homework in terms of looking at your own agency safety policies if you haven't already. And then again, we'll have a part 2 on de-escalation. So there's more to come. So we just touched on de-escalation, and there's more on that topic. So important. And I'm going to go ahead and put in the chat. Let's go to the next slide. Our prompt to give us some feedback today on today's session. We always love to hear from you. So please click on that link that I just placed into the chat And again, Karen and I really appreciate your great participation. It's great to share with each other your strategies, as well as, us getting to share what we know as well. Thanks so much, and have a great rest of your day.
Yeah.
And there's our de-escalation webinar coming up. Thanks, everybody.